You smell. When my grandson told me that, I lost all dignity. I had a stroke a year ago, and since then I've been incontinent and find it difficult to deal with personal hygiene. One day, Andy, my best friend, came to the house and found me staggering dangerously to the toilet because I couldn't bear the idea of my daughter having to clean me afterwards. Now, I know there are thousands of people like me living with conditions that rob us of our dignity and independence.
When I saw Peter's condition that day and the distress he was going through, I knew I had to do something about it. And I went home and I came up with the idea of the Dignity Mobile B-Day commode. But I went and talked to his physiotherapist and his occupational therapist, and they both said it was a good idea. They got the concept straight away. They referred me to the William Merritt Centre in Leeds, and when I went to see them, they thought it was a great idea and they encouraged me to go further with it. And then I got a little grant from Kirklees and Calderdale Enterprise Scheme for a couple of £1,000, and importantly they referred me to Devices for Dignity. And D4D, since I came to see them with the prototypes, it has surged forward dramatically. They have given me access to prototyping, device development expertise for an exhibition model, and they have made my vision a reality.
We were delighted to help Andy, because that's exactly what Devices for Dignity is here to do. We bring patients, carers, academics, clinicians, nurses and other healthcare providers together with industry to deliver innovative medical devices which help patients with long-term conditions, preserving their dignity and independence. Our aim is to drive the development of new healthcare products which will empower people with long-term debilitating health conditions, enhancing and enriching their lives. Andy's invention is just one of many which Devices for Dignity is helping bring to patients to reduce morbidity and improve quality of life.
Devices for Dignity is an important initiative which has been established by the Department of Health. This takes account of the patient-centred approach to identify unmet clinical needs and combines the extensive expertise within the NHS with that of academia and also industry. We do know that long-term clinical problems are a very important issue in the United Kingdom. Well, certainly we know that at least 6 million people in the United Kingdom are affected by urinary incontinence at some time in their adult lives. Now, as well as supporting the development of new devices, for instance the Dignity Commode, Devices for Dignity is also helping to produce new innovative approaches to the assessment of symptoms, and this way we feel we can deliver innovative solutions to the real problems experienced by the patients that we see in our clinical practice.